So I've been working from home for about 5 years as a registered nurse. I work for a big insurance company, and I've done two jobs with the insurance company. I've done review, which is concurrent review, and I have done case manager. That's what I do now. So these are two jobs that you can do as a nurse to be able to work from home. As a reviewer, I did reviews for inpatient stays in big hospitals and stuff like that, and small ones too. So I used to review the medical records. They would send the medical records, and then I would review them to see if they met medical necessity. So we would use something called interqual for medical necessity. There's other parts of that do other things like prior authorizations and post service and stuff like that for other types of things. So they would use other things like medical coverage guidelines and things like that, but I used to use interqual, so it was pretty straightforward. If it didn't meet for interqual, then I would call the provider. I would request more information, additional information. If they didn't respond to me, I would keep trying to call the provider. You usually have like between 24 and 72 hours to respond, and then you would have to send it for denial to be reviewed by a medical director. So that's what I would do as a nurse. I had no patient interaction, only interaction with providers. Minimal documentation, it wasn't a lot, but lots of reading. You have to focus, so sometimes you want to listen to music or do other things at the same time, and you have to really be focused on what you're reading. But overall, it wasn't a hard job or anything like that. It was good. The only reason I left that position to go to case management was I started to miss the patient interaction, and I didn't like the new structure. When we had a new person in leadership, they kind of mixed everything around and changed our whole flow of everything, changed our productivity, so I decided to go to case management. So in case management, I switched over to that. I've been doing that for a couple of years. It's a lot more relaxed. It's a lot more laid back than was. Was very strict, and everything had to be time, and there was pressure, and there was a timeliness that you had to have everything done. Case management is not the case. There's nobody going behind you micromanaging your stuff. So that's been kind of nice. But on the other side, of course, there's pressure. In the past years, they've changed our numbers as well, the numbers that we have to meet. We have to make a certain amount of new engagements with new members or patients per day. So that's been kind of more stressful as it was in the beginning, but maybe those things will change. Things change over time. So you have lots of patient interaction, of course, with case management. There's a lot more documentation, not a ton of reading. Sometimes you do read medical records just to kind of see what happened with that patient that you're calling that was in the hospital and they're going home or they're getting ready to discharge, things like that. There is calling providers, not a ton of it, but there is some. So you do work with some providers, depending on where in the state you are. It depends what kind of interaction you have, whether it's easy or not. Some providers don't call you back at all, and other ones are really good about calling you and wanting to help. So that can be a little bit stressful. You have to be knowledgeable on the disease process. You have to know what you're teaching. You have to be able to talk to the patient to help the manager help better. That's how you save the company money. So, you have to enjoy teaching and educating. If you don't like to teach, don't be a case manager. Enjoy talking to people. They're going to tell you their problems. They're going to get sidetracked. You're going to get people that don't want to talk to you at all. You're going to get people who don't ever want to stop talking. So you're going to get both sides of that. what I like to say sometimes is that I have to sell people stuff for free. I have to sell them better health for free to get them to want to talk to me. So, because not everybody wants to talk to you. Not everybody wants to manage their diabetes better. Not everybody wants to manage their heart disease better. Not everybody wants to stop smoking. So these are things that you have to keep in mind. It's not always going to be like a nice phone call where they're expecting you to call and they want your help. I'd say, out of 100 people that I call, maybe, 20% of them want to change and want my help, while the rest of them are just like, whatever. So that's basically what a UN reviewer does versus a case manager. There's lots of work from home jobs for nurses nowadays. There's lots of companies that hire. A lot of insurance companies hire. So if you're looking for that kind of a job, you want to probably look for one of those companies. You'll have a better chance of getting in. If you've done case management before or UM, of course it's going to be easier, but it's not required to have experience. So a lot of these places are looking more for your personality, if you fit right with the team. You want to be somebody that is kind of charismatic and positive and the right personality. So, if you're like if you're not super friendly, if you don't work well with others, they might not hire you. So keep that in mind. So if you have questions, post it in the bottom and subscribe for more videos about nursing and taking care of your health, working as a nurse, nursing students, and all of that. Thanks. Bye.